According to research, more than a quarter of all people living in Wales are disabled, and this number is expected to rise significantly in the future. With the enactment of various laws to protect the rights of disabled people, there has been a marked increase in the number of public facilities accessible to disabled community that is more convenient for them. However, disabled people, especially disabled women, still suffer from inequalities in many areas. The outbreak of the COVID-19 pandemic in 2020 has exacerbated these problems.
My name is Kat Watkins. I was diagnosed with something called osteogenesis imperfecta, or brittle bones, when I was born.
As a wheelchair user, Kat needs to be looked after. However, more time is still spent by Kat alone, especially the several lockdowns during the pandemic made her feel very lonely.
Completely shut down all of a sudden was quite hard work. And also living with one person all the time and not seeing anyone else was really hard, and not speaking to anyone else. And if there was a language barrier as well, I found it really difficult, like not being able to talk to people and have them understand me. It became really frustrating for me. I also feel that the pandemic has altered people's social skills quite a lot. I mean, since we've come out of lockdown and stuff, disabled people get treated so differently to how they were. Like, I don't know, people are just rude now. But going back 2 years, it was completely different. It's just like they've lost their ability to know how to treat people.
Lily Lash is in her third year at university and was diagnosed with a chronic illness last year. She's often embarrassed by the rudeness of people.
I get a lot of abuse from the general public for making use of facilities for disabled people because I don't look disabled. I look fit and healthy, even though I'm not. And that's very rude, actually. And I have an invisible illness and I have every right to use a disability seat. It does get quite embarrassing when people start looking at you funny or, whispering or even outright saying things to you. There are many reasons why people do those things, and to be discriminated against because I don't look disabled, because I'm not using mobility aid and I don't have like a back brace or anything like that. I just try and forget it a lot of the time because I know it's going to happen. There's not a lot I can really do about it when it does happen, and it does make me feel quite horrible because I then start questioning, well, do I really need to sit in the disabled seat? Do they have more rights of the seat than I do? I really start to question myself and my own disability and whether or not I actually need to use the accessible facilities. The answer is yes, I do need to use them, but it makes me second guess because I don't look disabled, so should I use them?
Also, as a patient with an invisible disability, Louise has often been misunderstood due to poor physical coordination since her diagnosis of ataxia in 2013.
People presume we're drunk. That's why the little card I gave you from Ataxia UK, it actually says I'm not drunk, I have a medical condition. So can you imagine when I'm going out and about, even with my walker, it is more visible, but people think, oh, she's drunk. But when I actually explain, no, I can walk, it's not a bone problem, it's a brain problem. If I don't have the walker when I'm out and about, I'm going to fall over because there's no balance, it's affected, the coordination is affected.
A complex and rare neurological condition, ataxia brings Louise ever-increasing symptoms and reactions. She's constantly searching for ways to keep herself mentally and physically fit. However, the outbreak of the pandemic has brought all her efforts back to the beginning.
So when the COVID hit, it exacerbated everything. So the ataxia condition became more difficult, and the loneliness and the isolation and the drop in confidence. And I'm still trying to rebuild. I'm getting there. I'm a very determined person. But it's definitely set me back a lot. My husband was very, very supportive and reassuring because he knows how scary cognitive impairments is.
While she was under isolation, her skills of going out in the community had been lost because she wasn't using those skills every day. So relearning those skills again has been slow. It's still ongoing. Her memory has been affected as well. Now we have a whiteboard in the kitchen which we've had for quite a while. So we actually write those things down so Louise can look at the board and think, all right, we need to be here or we need to be doing this.
Exercise is essential. If I'm not going out every day, to familiarise with noise levels, light levels, conversations, it can become very, very overwhelming.
In addition to increase the risk of mental and physical health problems, the pandemic has also brought about a surge in demand for medical resources, which has made disabled women more negatively affected.
The pandemic has definitely affected my life, especially within chronic illness, because it's taking much longer to get appointments. Waiting lists are really long for hospitals, so it takes so much longer to see a specialist and so much longer to get diagnosis for anything that it's really, really difficult. I'm 9 months in now and still haven't seen a specialist to even try and treat my condition.
Many studies have reported that more female than male suffer from chronic illness. The engagement officer of Failed Treatment for the Women of Wales says this makes it difficult for disabled women to access healthcare during the pandemic.
We know that more women have chronic illnesses than men do. We know that things like fibromyalgia, ME are experienced by, sort of 80%, 90% females to men. So all of those sort of health conditions have already got more female patients than male patients. And what happened at the start of the pandemic was how you got a GP appointment, an appointment with your primary care, that just changed sort of overnight. So it would be that you rang up and it would be even longer delays on the phone getting through.
Fortunately, the assistance of family and friends helped Lily through the toughest times.
I'm very grateful for everyone who has helped me over the last year. Everyone who's given things up to help me. They would also pick up medicine for me. They sit in A&E with me for all hours, and I wouldn't have got my medication, any of that, without their help. And it's definitely made a huge difference in my life. I know that it's been really hard, and it's been really hard for all of us, and I'm grateful for everyone that's stuck by me, and I hope it's not like this in the future, but it might take a couple of years to settle down again. I'm just really grateful to those who help me and stick by me and will do in the future as well.
For Louise, her husband's companionship has helped her to rebuild her confidence, and being a determined person herself, she's confident that she will eventually overcome these difficulties.
Life is very fast for even healthy people today. And for me, because I've been shielding over a prolonged period because of my health conditions, you beautiful girl, I wouldn't give up and think or panic, oh my God, my brain's getting worse. I'm thinking, no, this is COVID. Brain fog is going to hit. I'm going to deal with this slowly. Thank God for creative projects like People Speak Up in Llanelli, which is a town not far from here, who was supporting via Zoom, so the creativity and contact was there. And if it wasn't for that, I would have been totally isolated.
For Kat, she has found something she truly loves that allows her to stop wallowing in an emotional state of isolation.
Last year, I did an internship with Disability Wales, the national organisation for disabled people in Wales. I realised that a lot of what I was feeling inside, they were doing, and they were trying to get the messages out and things like that. After I finished my internship, they asked me to come back as a paid member of staff, which was like, wow. And I was like, I'm actually getting paid to do something that I love and fighting for the rights of disabled people.
The convenience of working remotely has enriched Kat's life and exposed her to new things.
It definitely opened a lot more doors, and I was actually a lot busier than I had ever been, like going to meetings and interacting with like officials and things like that, and taking on like extra responsibilities because I could do it from the comfort of my own home, and I didn't need to travel and use extra energy trying to get to places, and it was quite nice.
Disability Wales has been fighting for the rights and equality of disabled people in Wales. Due to the employment gap in Wales, Disability Equality Officer Alex believes the pandemic has raised awareness of remote work among disabled women to some extent.
The employment gap in Wales is particularly high. It's about 36% as an average in Wales. Goes up to about 50% in some more rural places. We did hope that the pandemic would kind of show a different way of working, that actually home working was really good. Make sure that everyone knew that they had the rights the same when they were working from home. They had the rights to equipment that we would buy at Disability Wales would pay for. We wanted to make sure that people would have everything they needed to be able to fully work to their full potential at home. So we think that's one benefit, is that disabled people can now access more jobs because they can be done remotely. So we think that is a benefit from it. We also think that the pandemic also brought a bit more knowledge around that there are disabled people out there, and the kind of vulnerabilities of some people as well.
In response to the issues that have risen for disabled women during the pandemic and some of the barriers that disabled groups already face in society, Social Justice Minister Jen Hutt said the Welsh Government has a clear commitment to the promotion and protection of the human rights. This undoubtedly also includes the protection of the rights of disabled people and women. The Welsh Government's Advancing Gender Equality in Wales plan to address the changing circumstances of women in Wales. Meanwhile, the Disability Equality Forum, chaired by Jen, continues to provide an opportunity for stakeholders to advise the Welsh Government on key issues affecting disabled people in Wales. The Welsh Government also funds and works with guilds and associations to benefit disabled people and address their inequalities. Jen Hutt says the Welsh Government is working to better develop effective policies to break down barriers and inequalities for many disabled women in Wales. It is a constant struggle and a long process.
Are still underrepresented, still not recognised with equality.
Just disabled people in general, I think we need to have a bigger voice.
I just want the rights that everyone else has, and that everyone should just be allowed to live, because we're all human at the end of the day.